Okay, let's dive into this. Today, we're exploring a concept that absolutely transforms how we think about medicine and recovery. We're talking about how effective healthcare goes way, way beyond just treating your physical body. It's really the science of healing the whole person.
So why does depression actually delay physical wound healing? It sounds kind of like science fiction, right? But it's a proven reality from the Sheltering Arms Institute. Our physical health is just inextricably linked to our mental state. Your immune system, your pain receptors, even your body's cellular repair mechanisms, they're all constantly listening to your brain.
To really wrap our heads around this, we need to look at a foundational concept, the biopsychosocial model. For the longest time, medicine kind of just lived purely in the bio section, biology and anatomy, but this integrated approach recognizes that biological, psychological, and social factors deeply interconnect. They literally determine your overall health and recovery. In today's explainer, we're going to trace an arc from the micro right up to the macro, starting inside the individual mind, moving to the dynamic between doctor and patient, and finally looking at systemic care.
So here's our roadmap for this explainer. We'll start with mind and body recovery, followed by the psychology of pain. Then we'll examine the communication gap, understand patient behavior, and finally finish up with integrated healthcare solutions.
All right, Section 1, Mind and Body Recovery, the internal connection. The data on this is honestly staggering. Poor mental health actively impedes physical repair. Depression can literally lengthen your recovery time after surgery. And anxiety and hopelessness, they don't just make you feel bad emotionally, they literally worsen physical symptoms. Even negative emotions and a thought pattern called pain catastrophizing can alter how your nervous system processes pain sensations. And on a super practical level, a lack of motivation directly interferes with the vital sleep, diet, and physical activity required to heal. So a holistic mindset isn't just nice to have, it's an absolute clinical requirement for successful rehabilitation.
Let's move to and see how this builds into Section 2, the psychology of pain, modulating perception.
This brings us to specific psychological interventions, starting with cognitive behavioral therapy, or CBT. Now, CBT is incredibly effective for managing chronic pain. It targets those maladaptive thoughts, like that pain catastrophizing we just talked about. By breaking the automatic cycle of assuming the absolute worst about a physical sensation, CBT reduces feelings of helplessness and that fear of movement. It basically replaces negative destructive beliefs with adaptive cognitive frameworks. It uses practical tools like goal setting and activity pacing so you can safely push forward without triggering a major physical setback.
Next up, we have mindfulness-based interventions. This involves practices like meditation, body scanning, and focused breathing. And what this does is cultivate a non-judgmental awareness of bodily sensations. It essentially creates a critical mental buffer between the raw physical sensation of pain and the emotional distress that usually follows it. By disengaging from endless cycles of worry and rumination, mindfulness actively decreases the affective or emotional component of pain. So you still feel the sensation, sure, but the suffering attached to it is dramatically reduced.
And then there's acceptance and commitment therapy, or ACT. This approach is really all about promoting psychological flexibility. Instead of wasting energy fighting a relentless, exhausting war against chronic pain, it reduces the struggle. It asks patients to identify their deep personal values and shift their focus. So instead of simply avoiding pain, you're engaging in meaningful life activities alongside the pain. This approach really empowers patients to live purposefully, which researchers note greatly improves functional outcomes and adherence to rehabilitation.
Moving on to Section 3, the communication gap, disconnect in the exam room.
Now, what's really interesting about this slide is the massive perception gap revealed in these two statistics. This data from the Oxford Journal is just stark. When surveyed, 75% of orthopedic surgeons believed they communicated satisfactorily with their patients. But when you ask the patients, only 21% reported satisfactory communication. Wow, that is a massive disconnect happening right inside the exam room. Doctors are vastly overestimating their bedside manner, while patients are leaving feeling unheard and totally confused. And, as you might guess, this miscommunication has some serious medical implications. It hinders a patient's understanding of their prognosis, decreases their hopefulness, and ultimately delays recovery. But why does this massive disconnect happen in the first place? Well, research points out that doctors' communication skills often actually deteriorate during their education. The emotional and physical brutality of medical training can suppress empathy and lead to avoidance behaviors. Doctors might avoid emotional conversations simply because they lack the time or training to handle them, which unfortunately discourages collaboration and leaves the patient feeling completely disempowered.
Okay, Section 4. Understanding patient behavior, the role of social context.
Modern patients don't just passively absorb medical advice, and this brilliantly illustrates how expert information is actively reconstructed through four surrounding lenses: the patient's own perspective, their experience, their knowledge, and their societal reality. Science and social realities are constantly intersecting in the patient's mind.
To impartially demonstrate this, researchers looked at female patients in the Appalachian region of the United States. Doctors gave clear expert information: avoid the sun to prevent skin cancer. However, the patients modified or just flat out ignored this medical advice because societal pressures in their community equated tanned skin with beauty. They continued to tan despite knowing the biomedical risks. This perfectly highlights how social relationships and cultural context can easily override pure, objective medical facts. If a doctor doesn't understand the patient's social reality, the treatment plan is probably going to fail.
Finally, Section 5. Integrated Healthcare Solutions, Fixing the System.
Consider how the data from Healthy Minds tracks the evolution of healthcare from isolated silos to true whole-person care. At Level 1, coordinated care, physical and mental health are totally separate. You go to different buildings, have different doctors, and they rarely ever talk. At Level 3, co-located care, you might have your therapist and your primary care doctor in the exact same building, which is definitely better, but they still operate on separate plans. But the absolute gold standard is Level 6, fully integrated practice. We're talking universal screenings, collaborative plans, and a seamless patient experience managed by one unified team.
A prime example of this Level 6 approach is the collaborative care model. This model utilizes primary care as the central entry point. You have a patient-centered, multidisciplinary team doing universal medical and mental health screenings for everyone. It uses measurement-based care to rigorously track symptom changes over time. And beautifully, it uses consulting psychiatrists who advise the primary care team, catching mental health conditions early before they spiral into crises. Actually, studies show this exact model reduces emergency room visits by an incredible 54%.
So, the crucial point is, to really grasp the systemic impact, you have to consider the difference between these two numbers. In a traditional one-on-one practice, a psychiatrist might serve around 17,500 patients over their entire lifetime. But a psychiatrist working as a consultant within the collaborative care model, they can impact over 226,000 patients in their lifetime. By integrating care, we exponentially multiply a single mental health provider's reach, completely transforming the healthcare system from the ground up.
But even with all these brilliant systemic models, we have to bridge the data back to the human element. Former American Academy of Orthopedic Surgeons Vice President Terry Connolly famously said, "The patient will never care how much you know until they know how much you care." Empathy is the ultimate foundation here. Whether it's mindfulness for pain, navigating a patient's social reality, or integrating clinic teams, human connection is the absolute core of medicine.
Which leaves us with a final thought to take with you. How will you advocate for your own whole-person care at your next doctor's visit? Remember, your mind, your social environment, and your body are all part of the exact same healing process. Speak up, ask questions, and make sure your entire self is being treated. Thank you so much for exploring this explainer with us, and we will catch you next time as we continue to break down the world's most fascinating research.